how is it you speak out and so few other doctors do?
I've always been a bit of a doo-doo disturber, and
give us an update on that, Dr. Nagase, and we'll just kind of go from there and get everybody posted on this new information that's come out, because Dr. Mel has just gotten out of the hospital today, so very long day for him.
Thank you very much for having me on. So the situation started on December the 8th of last year. Mel Bruchet, he's an 81-year-old grandfather. He was taken by force from his own house with 8 police officers, 4 squad cars, taken out of his own house, marched up the street where he lives in front of all his neighbors in handcuffs, and then taken by the RCMP to the hospital, the emergency department, for a psychiatric assessment. So I was actually on an interview with the Western Standard when this all went down. And when I finished my interview with the Western Standard, I asked, where did Mel go? And there was 2 other doctors who were in the house at the time, because Mel was having meetings with activist people who want to raise awareness to the truths about this coronavirus epidemic and these injections. So I eventually received a phone call from the emergency department from Dr. Bruchet. And then he says, well, he wanted me to talk to the emergency doctor who was on. So I told her the whole story about how, both Dr. Bruchet and I and the other house guests that were organizing a weekly Sunday event, I explained to the emergency doctor, everyone's been sleep deprived. There was a situation that occurred from the night before where everyone was kept awake till 3:30 in the morning by a tenant at the hospital. Not at the hospital. Sorry, I have another guest here. A tenant in Mel Bruchet's own home. And so she didn't seem very interested at all in knowing the specifics of why, Dr. Bruchet might be sleep deprived. And she just kind of said, yeah. And I thought, okay, well, maybe she's a very busy emergency doctor. She just wants to get to the next patient. So then I was very surprised about an hour later to get a phone call from Dr. Bruchet calling me from the emergency department saying he's being held in the hospital involuntarily because he might have a diagnosis of frontal lobe dementia. Now, I'm an emergency doctor, so if I suspect a patient has dementia, well, my first question is, how bad is it? Are they able to find their way back home? If a patient is able to find their way back home without getting lost, they are not so demented that they need to stay in the emergency department. The next step I would do is say, call a friend, call a family member. Can they take care of you? It's okay to forget things every now and then. I forget things every now and then. It doesn't necessarily mean you need to be in a hospital. Forgetting things every now and then might be early dementia, or it might be normal. That's no reason to keep someone in hospital. But Mel told me on the phone that the emergency doctor, she was keeping him involuntarily, forcibly confined in the hospital because he might have dementia. So that didn't make any sense to me at all. But what's worse was after that, after the emergency doctor certified and made Mel an involuntary patient, a psychiatrist came along and seconded that opinion. So basically confirmed that Mel should be held in the hospital involuntarily as a psychiatric patient because he might have dementia. He might be forgetting things more often than he should. And that's how it all started on December the 8th. He's still recovering from being forcibly medicated. So over the past 3 weeks, he was in the hospital for 25 days. He was forcibly medicated with antipsychotics. And the thing is, Mel Bruchet, Dr. Mel Bruchet, is an 81-year-old grandfather. It's been known for over 10 years that anyone over the age of 65, anyone getting into the sunset years of their life, they should never get antipsychotics because antipsychotic medications can cause strokes. And in fact, the older you are, the more likely it is that an antipsychotic medication will cause a stroke. Now, normally as an emergency doctor, I would only give antipsychotics if someone's hallucinating. They're seeing things that aren't there. They're hearing people that aren't there, right? Or if they are, extremely high and out of their mind on some kind of substance, and I need them to stop, tearing light fixtures off the walls or flipping over bed mattresses. Yes, I'm an emergency doctor. If someone needs to be brought down from whatever's plaguing their mind, whether it was a bad dose of methamphetamine or cocaine or whatever's going on in the streets, I will give them an antipsychotic. But not to an 81-year-old grandfather who's never had any criminal record, never had any history of violence. There is absolutely no justification to give an antipsychotic. There's no hallucinations, there's no violence, there's no threat to harm themselves or harm another person. It's just absolutely unconscionable from an emergency doctor's standpoint to take that type of a risk with an elderly patient, to give them an antipsychotic that might cause them to have a stroke 3 days later. So before he started to get mini stroke symptoms, 3 days, they forced him to take the medication, and they basically said to him, you take this medication or else we'll hold you down with Paladin security guards and force you to take an injection. You either cooperate or you get bruises and we give it to you anyway. That was basically the options he was given, Dr. Bruchet. So he took the medication, and after the 3rd day, when he finally got access to the phone, because they severely restricted his access, they wouldn't let him have any access to the phone for 5 days at a time. When he first went to the psychiatric ward, they took away his cell phone. No access to the cell phone. And then a few days after that, they wouldn't even let him use the hospital phone to call friends. So 3 days after, he was forcibly given this medication called Abilify, which is also called aripiprazole. He started to have slurred speech, and he had trouble remembering names. So in medicine, in emergency medicine and neurology, we call that word-finding difficulty. So here is a family doctor. He's been a family doctor for longer than I've been alive. He's 81 years old. He just retired three years ago. He is the most loquacious, eloquent person imaginable. And all of a sudden, he can't talk straight. He's stuttering, and he's having trouble remembering words, especially names. Those, from an emergency doctor standpoint, are signs of a stroke. And this is 3 days after he started an antipsychotic medication. And so at that time, I asked for the emergency department to give me the name of the neurologist on call. And the neurologist on call, I think it was either Dr. Wang or Dr. Wong, they went up and they assessed Dr. Bruchet to see if he had a stroke after being forced to take an antipsychotic medication. Unfortunately, the neurologist at the time refused to disagree with the psychiatrist. It was this, we're both specialists, we're not going to make each other's lives difficult, we'll just kind of ho-hum and go along with each other. And that, to me, as an emergency doctor, is extremely offensive, because this information has been out for more than 10 years, especially in the cardiology literature, which is talking about heart attacks that might be increased with antipsychotic medications. The neurology literature that says, yep, we did notice a significant increase in strokes after patients were given antipsychotics. And of course, because the emergency doctor has to know a little bit about everything, it's in the emergency medicine literature as well. The danger of giving an antipsychotic to an elderly person. And yet, for some reason, 3 psychiatrists in the North Vancouver hospital, which is Lionsgate Hospital, all decided that, yep, it's okay to give someone who's 81 years old a medication that might cause them to have strokes.
you.